Doing tonight. So I'm my name is Jennifer McNish. I'm an occupational therapist here in Calgary, but my hat is also as a director here with the Alberta Lymphedema Association, and my co-facilitator tonight is Heather Watt. And she is a colleague in Edmonton at the CRIS program and an occupational therapist there. And I'd like to say that she's the one who inspired me to do lymphedema. So it was
Aw.
the clinic that actually I first saw it happen. And I was like, what is this diagnosis? And that kind of adds to the whole picture that we may be discussing today. And it was like, I need to know what to do there. That's just she was an inspiring she doesn't even remember that first encounter I had with her, but that was inspiring having her
I do
tell me.
remember a phone call with you. I do.
I was actually at your clinic.
I
But
may not remember that.
yeah, so I'm really happy to have Heather there. Heather, join us. And we're going to be asking questions to Karen and Carissa. Just going to go through a few questions to have them share their experience. And Heather's going to begin, and we're just going to alternate the questions going back and forth. So, the purpose of today is just to kind of get the patient's experience in lymphedema management and just kind of give us the sort of the story of their journey in lymphedema treatment. So,
Great.
without further ado, I'm going to let our participants today just tell a little bit about themselves. So, Heather's going to be asking the first question.
So the first question is, first of all, thank you for having me. Thanks for asking me to do this, Jennifer. It's nice to be a part of things like this. So the first question is, would you tell us a little bit about yourself and briefly give us a summary of your lymphedema diagnosis? Um, I guess you guys, either of you can, who's gonna go first?
Who's gonna
Karen,
be
you popped up first. Your face
me?
popped up first. Your giggle. Go ahead.
Okay. Hi everyone. I'm Karen. I'm retired, married with two daughters and one stepson, so we have a blended family here. I've had lymphedema for guessing about 20 years now, and yeah, it was an experience to go through. To find out exactly what it was that I had, because I had, excuse me, I had cellulitis initially. And at that time there, they thought that I had a tubal pregnancy, go figure, because I was going through menopause at the same time. So long story short, over a period of time, they figured that it was lymphedema that I had. And I wasn't pregnant.
All right. Carissa, tell us a little bit about yourself and about your diagnosis.
So my name is Carissa. I'm actually on the board of directors of the Alberta Lymphedema Association. And I joined them about 2 years ago because of my own experience with lymphedema. I just turned 40 this year. I've had lymphedema for 15 years. However, I was only diagnosed 11 years ago. The first 4 years of me battling with lymphedema, was a lot of misdiagnosis. I had to see multiple doctors, and because I am overweight, my doctors, all of the doctors, the first four doctors that I saw just kind of wrote it off as, oh, you need to lose weight and the swelling will go away. My condition started similarly to Karen's with an incident with cellulitis. Mine was from a spider bite and it developed into cellulitis, and I was hospitalized and there was swelling in both of my legs. And that swelling just never went away. So I had to battle with doctors and fight with them saying, look, I've been overweight my entire life and I've never experienced swelling like this before. This is not normal. This is not just me being overweight. And then ultimately it took a move from Saskatchewan to Alberta to find a new doctor. The move wasn't to find a doctor. It was because my husband was relocated with his job. And finally, being in Alberta and kind of doing some research on my own, I found my doctor, and she didn't initially know what it was, but she was not writing it off that it was just a weight issue. She knew that there was something else going on. But I actually learned about lymphedema by looking at a news article. A woman that I had seen had been refused treatment at a hospital, and there was a picture of her in the newspaper, and it was like looking in a mirror. Her legs looked exactly like mine. So then that intrigued me even more. So then I continued reading the article and found out that she had lymphedema. And then I was like, okay, I need to research all that I can about this. And then I took that information to my doctor and I said, this is what I think I have. Like, I meet all of these requirements. And then my doctor had never really heard about lymphedema before, wasn't very familiar with it. So then she did her own research, and then saw me a few more times. And then we finally came up with that I did in fact have secondary lymphedema in both my legs. And then as the disease has progressed for me, I have had my lymphedema move up into my abdomen. So that was kind of like the starting of my journey for me.
Thank you for sharing.
thanks, guys.
Jennifer, you're going to ask the next one.
Yeah, so going sort of sticking with the question about diagnosis, because we know that's often a problem. That's one of the biggest hurdles to encounter. How were you diagnosed? So, I mean, you talked a little bit about it already. So you already experienced you explained a little bit about your difficulty. Did you find a healthcare provider who could diagnose you easily? And yeah, so starting with you, Karen.
Oh, yeah. As I'm listening to Clarissa's story, I'm sitting there thinking, oh, yeah, some of that sounds familiar. Because initially, after cellulitis and going through all the IV and whatever else, I went to see a series of doctors and going through a series of tests and to try and determine exactly why there was swelling there. They didn't seem to know very much about lymphedema or anything at that time there. And initially, they thought that maybe I had scleroderma and was sent to a room specialist.
Rheumatologist, probably.
Thank
Yeah.
you. And but she didn't feel that it was scleroderma just because of the way that I was explaining what had happened and whatnot. So
So would you explain a little bit about where you experience lymphedema, which part of your body?
it's the lower, like from about my knee to my feet on my left leg, mostly. And yeah, it's just going through a series of tests. I went through some crazy tests at the hospital because they were trying to determine if there was enough blood flow throughout my legs. And so went through a lot of that type of testing. But it was when the doctor was saying that she thought that it was scleroderma that I kind of went, oh, that's interesting, because I didn't know very much about that, but I had heard that that was not necessarily a good thing either.
So you saw an internal medicine doc or rheumatologist. You saw a few different specialists to rule it all out.
Mostly, it was mostly like through my family doctor that I was sent through all these different tests. And
did you have a lymphoscintigraphy?
I'm sorry?
Did you have a lymphoscintigraphy?
I don't know what that is.
Oh, okay. I thought maybe the lymphoscintigraphy is actually a diagnostic tool where they put some radioactive dye into a nuclear medicine test that they put some dye into between.
Oh, I've had that.
Yeah. So,
Yeah.
or in your fingers, like right between your web space and your toes, and then they watch it track through your system.
Yeah.
So you did have one.
I did.
Okay.
Yeah, that I know, I remember because I asked them if I was going to glow in the dark after.
Yeah.
I didn't
So
know.
that was helpful in confirming the diagnosis.
I think so, yes.
Okay.
Some of it I can't quite remember.
Yeah. All right. Anything else as far as any other, how many years did it take for you to get diagnosed,
Oh, geez.
or months?
I really don't know. It seemed to take forever because I was going back and forth to doctors all the time, but then also going through other things like going through menopause at the same time. Didn't know if that was affecting it or
Yeah.
whatever. So yeah,
Okay.
it just I don't know exactly how long
Took a while.
it did.
Have to be persistent.
Yeah.
Yeah. And Carissa, your experience and how you were diagnosed.
Yeah, so, after battling with different doctors, the first time that I had cellulitis that really kind of catapulted this whole disease for me, it was actually my family doctor at the time that was in the emergency room when I went into the hospital, and he was very weight conscious, weight focused. And so when I saw him for follow-up after the initial cellulitis and the swelling still wasn't going down, I was like, look, this isn't normal. Like, you've seen me as a patient now for how many years? You know that my legs are never swollen like this, but yet he wasn't willing to take off his blinders and look past my overweight, my obesity. He wasn't willing to look past that. So I went to a different doctor, and I went to a female doctor this next time, thinking that, okay, she's going to have some compassion for me. She's going to listen to me. But same thing with her. She would not take off her blinders that I was obese and that I was overweight and that there was possibly another underlying cause for the swelling. So after seeing her and two other doctors, another female and another male, I was almost at a loss. Like, I was like, okay. And at that time also, I was going through a weight loss program. I had lost about 75 pounds, but the swelling had not gone away in my legs. So I was like, okay, I don't think weight is the issue here. Obviously, it's not helping, but it's not the only cause for this significant swelling. So when my husband and I moved to Alberta and I was finding a new family doctor, I didn't know how to approach it without being felt like I was delusional or that I was just making things up because I wanted to find an answer, that I was just trying to write off the fact that maybe it was because I was overweight. But when I found my family doctor, and she's still my doctor to this day, it was the most rewarding experience to have her actually sit there and listen and actually hear me. There's just something different when you know, or you felt heard. It was validating knowing when I finally got that diagnosis, when I had seen the news article, I did the research, I took that research to my doctor. The fact that she went in and looked into more information herself and took that time to educate herself, was really important for me. Now, I didn't go through any official testing because I didn't know what needed to be done at that time. And I don't think my doctor was aware of it either. But I remember, like, I did get an ultrasound on my legs. She wanted to rule out like blood clots and stuff like that. So I did have ultrasounds like right from my groin, all the way down to my ankles and my toes. And my lymphedema is actually kind of opposite of Karen's. Mine is predominantly in my thighs. My lower legs have swelling, but nowhere near my thighs. My thighs, I have massive lobules on them, so it really affects my walking and my gait, especially. But yeah, after waiting that 4 years and finally getting that diagnosis, it was a sense of relief. But then it was also, okay, where do I go from here? Because if my doctor doesn't even know about lymphedema, and I essentially had to bring the disease information to her for her to seek out that further education for herself, I was like, okay, well, how do I get help and how do I get treatment from this point? And then I was kind of like, I don't know what to do. I was lost. So she then referred me to, I believe that was the Chris Clinic, when I was first referred after my initial diagnosis.
Okay. So I guess that goes on to the next question. You're leading this very nicely along the way. Heather's going to ask a question about the next part of your journey.
So the next question is, once you were diagnosed, would you just describe your experience in finding a provider to treat your condition? I guess we'll start with Karen. Go back to Karen.
I don't recall ever being sort of brought into having a provider as such. It was just suggested that, you know, maybe I go and get measured for compression stocking. And I believe that was just my family doctor that had suggested that at the time. So I had gone in to get that done. And I honestly, I can't remember that part of it, but I do remember eventually going into the Sheldon Schumer and starting on treatments there and getting assessed for the first time, like actually assessed. That was probably the best thing that could have happened to me as far as that goes, because then it was somebody who understood what I was going through and, you know, taking it from there and then giving a little bit better treatment, better stocking fitting, things like that.
Okay.
So you just got a prescription from your GP and then you went to see a vendor and they got you a stocking, which was
That's
probably
right.
circular knit stocking.
Yeah, it was like a full stocking and yeah.
Okay. And
Carissa, what's your experiencing with finding a provider?
Yeah, so I'm 15 years into my 15 years into having lymphedema, 11 years into my diagnosis. I was referred to the Chris Clinic, and I went and saw the Chris Clinic 10 years ago. And this isn't anything bad against the Chris Clinic. I think the Chris Clinic has an amazing platform and they have come so far. But when I initially went in, because I am significantly obese, I am morbidly obese, I am a very heavy woman. Part of that has been because of the lymphedema, but I've always been heavy. So when I went 10 years ago, it was an experience that I left feeling a lot defeated, because they didn't know how to treat me because of my weight. With the size of my thighs and the lobules that I have on my thighs, they are massive. I've been told I carry between about 100 to 150 pounds of fluid alone in my legs. So that can kind of give you an idea of how large my lobules are. And the lobule is kind of where like your skin expands and it's holding on to that extra fluid, if anybody's not familiar with that. So I was basically, and Heather, you can correct me if I'm wrong. I was basically told, like, in order for us to wrap you properly, you're going to need to lose some weight first. And at that time, I was just entering into a bariatric program. But for me, mobility was very hard at that point already because my lymphedema had progressed so much in the 4 years that I went undiagnosed and untreated that they couldn't really do anything for me. Now, come full circle, 10 years later, I have just recently in the fall gone back to the Chris Clinic and was measured for wrapping, and my wraps actually just came in a couple weeks ago, so we're getting ready to start treatment on that. But really, that's the first treatment that I'm going to be getting in the 15 years that I've had this disease. Prior to that, the only other thing that I've ever had done is manual lymphatic drainage. And it worked for me the few times that I had it. But in order for me to be able to have consistent results, I would have had to go multiple times a week, which is not something that I could have afforded. Regular compression stockings were not going to work for the location of my lymphedema and the progression that I've had along with my weight. And again, I say all of this, and Heather is actually my therapist, my lymphedema therapist at the Chris Clinic. So I'm not trying to put the Chris Clinic down at all. I love the Chris Clinic. I think, and Heather and I've had this conversation before too, that, you know, medicine and products and stuff have come so far in the 10 years that I wasn't there. So they're better equipped to treat somebody like me now. Go ahead, Heather.
I was going to say it's not just the products, it's the skill level of
Yes.
the therapists. Like 10 years ago, in the past 10 years, we have learned and developed skills to treat legs like yours, and we're doing it successfully. And at the time, you're like you said, we weren't really sure how to take on what the shape of your legs and how to manage that, and that was really all we had was, let's monitor your weight, let's see what we can gain from that. And it kind of breaks my heart that happened. But you're back. I'm so glad you're back, and we're just going to move forward from here, and we will. I think that with the new products that are out, will be pretty successful for you. I'm excited to try. You're gonna have to call me.
Yeah, me too. Me too. And with, you know, with Heather's information there, like, I am an abnormal case. I'm a very large woman. I am on a weight loss journey right now. When I started my weight loss journey, with the weight loss clinic that I'm at right now, I was 650 pounds. That's a big woman. Like, that's a lot to carry around. That's a lot to treat. And so I don't hold any ill will towards the Chris Clinic. And the fact that doctors still don't know enough about lymphedema today, just think about how little they knew back then. And therapists, and that's of no fault of their own. It's just, it's not talked about enough. So I'm excited to see where treatments are going and to see where my own personal treatment can go, to get more mobility and to, you know, see where we can go with this. It's an exciting journey that I'm looking forward to continuing. So
I'm excited to go on it with you too, Carissa. You're amazing. You're just such a strong advocate, and we'll make some good changes for you.
We'll do it together.
Yeah. Sounds good.
Thanks, Heather.
So this is kind of leading us into that question about treatment. I'm curious about your things because I have a patient right now who are a similar situation you're in. So we'll be talking tomorrow, I'm sure.
Absolutely.
But Karen, would you just summarize your treatments that you've received to date? For example, like, did you get some wraps? Did you get some garments that were for daytime? Did you get any nighttime compression? That sort of thing.
Sure. When I did finally go to the Sheldon Schumer, and excuse me, that was in, oh gosh, that's almost 10 years ago now. I think, doesn't matter. That I initially had wrapping done, and that was really good because it did reduce everything. The only challenge that I had there was we have a very deep tub, soaker tub, and trying to bathe was an interesting, because you can't get wet, right? And then I had went to get proper fittings done afterwards, and had I think initially I had a full stocking, and then because my toes are also quite getting quite hard and firm, that it was decided to have a partial like an open toe stocking, and then have a toe glove. The only problem that I had with that was that at that time there was only the one kind that it was really thick, and the seams on there were really almost bumpy, so it made it very difficult to walk. Yeah, now I've lost track of where I was going.
But you ended up getting, did you get a foot glove in the end? You did get a foot glove.
I did.
Yeah.
And yeah, I did. And I did try and wear it for, I also had the ones for overnight.
Right.
But I found that so hot, very warm, especially
And
during that time there. I think I was still kind of going through the tail end of menopause, maybe. And you know
that
how
is a challenge wearing
it
garments
did.
and heat. Yeah, for sure. So you have daytime garments, they're custom garments.
Yes.
Can't remember what we're ordering for you, but I can't remember if it's foot glove or lower leg
At this
stocking.
time now?
Yeah.
Yeah.
Flat knit. Some custom flat knit garments, which is, and
I'm
then,
actually going to get measured for that tomorrow.
okay. And so, and then no nighttime compression because you were not wearing any nighttime. So then we were able to say that maybe we'll make a decision not to worry about the nighttime for now.
Right.
Because you've been managing well, keeping your limb volume. So fortunately, we've been able to stick with just daytime garments.
Yes.
Sorry to answer your question for you, but I'm just sort of summarizing it all. And did you experience or did you have you participated in any manual lymph drainage sessions?
We briefly talked about it, and I have been rather neglected in starting them. But yeah, I would definitely like to work on that.
Yeah. And so just to go privately for that, the options I think from our clinic was to be taught if you can do some self MLD, but I always tell
I
people,
think that's the route that I was going to go,
yeah,
was to do it on my own.
yeah. Okay. And skincare is all part of that whole piece that you're involved in, and you've been doing a pretty good job managing all that, doing moisturizing, using a good moisturizer for your skin.
I have a very lovely husband who rubs my feet every night before I go to bed. So
Oh,
yeah, that's helped a
why
lot.
we're doing no compression. That's right. He
That's
does.
right.
Yes. Okay. It's all coming back to me now. But you can have your own personal masseuse, or yeah,
That's right.
goes a long way. So Carissa, what you're in the process of receiving garments. What is it
I
that you're
am, yeah. So I've been measured already, and they actually just arrived at the vendor. They are actually a Velcro wrap. It's in 3 parts, I believe. So it's not your traditional wrapping because I am going to be doing it myself after Heather teaches me, and it works with me in the clinic a bit. But
reduction kit? Is that what it is?
pardon?
Is it a circade reduction kit?
Heather, I'm going to let you answer that one.
Yeah, if you're okay with me sharing, I
Go
can
for it. I'm
answer.
totally
Yeah,
fine with that.
yeah, we're doing full Velcro, like foot pieces, leg pieces, and the reduction kit for the thigh with a lobe kit, I believe we ordered. I'm not sure.
Yeah.
So we'll have to get her measured and teach her how to use it, and then see how well she does with it. Of
Yeah.
course, having someone, your spouse there would be helpful. That's going to
Yes.
be a big help to start learning it. And but yeah, we should make some progress with that.
Yeah. I know initially when I went like 10 years ago, there was talk about doing wrapping and stuff. And for me, I was working full time at the time. I was a branch manager with a financial institution. And so for me to have to take time off work to go in every other day for hours at a time just was not feasible for me time wise, but also cost wise. If they were even going to be able to go that route. But then there was the worry of where was that fluid going to go, especially with my weight and stuff. So being able to have the time right now because of my lymphedema and the way that it has progressed over the years and the weight that I've put on, I've ended up taking a medical leave from work. And it's been one of the best things for me because it's really given me time to focus on my health, both physical and mental health. And Karen, I'm not sure about you, but I know that for myself with having lymphedema, not only has it taken a toll on my physical health, but my mental health. It's been a huge contributor, because you're dealing with pain on a daily basis, and having to mentally push through that pain. It takes a toll on you. So I just needed that break from work. And so that does give me the time. It frees me up to be able to actually get the treatments that I need that are now available for me. And through taking that time off working, taking that step back, I've been able to actually become more mobile. So like a year ago, I couldn't reach my toes, and now I can actually reach my toes. I can put my own socks on. I can put my own lotion on my legs and my feet. I don't have to rely on my husband to do that. So sometimes taking a step back from things can actually be better for your overall health than sometimes pushing through because we think that we have to. So sorry if that's not really on the topic of the question, but that was
Oh,
just
okay.
something that I felt like I needed to share.
Yeah, thank you.
It's definitely part of managing lymphedema. It's not just a physical, it doesn't just affect you physically, for sure. It can be very
Yeah.
stressful. Okay, my turn.
And
I
you have
think,
to go soon,
oh,
Heather, as well, right? I'm not sure.
yeah, I
Yeah,
have to leave
that's-
in 8 minutes. Got a playoff hockey game to get to. So the next question is, I guess, which of the treatments that you have tried work the best and which treatments have not been effective? Go ahead, Karen. What do you think, Karen?
I think the best treatments that I've had so far is first the initial wrapping and then the compression stocking. The ones that I didn't find that successful were when I had the, like I was mentioning before, with the open toe and then the foot glove. The previous one, because of the seams, more so than anything else. And just, I'm not in the same situation. I don't have pain associated with mine. I have discomfort, but there's no pain, which I'm ever so thankful for. So for the most part, I think that it's managed with the best way is with the compression stockings.
Is there anything outside of compression that you do that you find help with your lymphedema to manage?
I elevate my foot
Okay.
quite a bit, and I find that helps. Those days when I'm really active, and if I haven't, there was a time when I didn't have any stockings, so I bought over-the-counter ones, and it's a lot less compression, and they were comfortable and everything, but it didn't contain it as much.
Mm-hmm.
And if I was on my feet for a while, or the heat kind of gets to me too.
All right. Carissa, do you have anything to add? Anything, I think maybe things that maybe you've tried in the last 10 years that make it better or make it worse?
Yeah, so similar to Karen, like the heat definitely has affected my lymphedema. When I was at work, I would always keep the air conditioning on because anytime I got hot, I just felt like my legs would swell faster and then they would sweat. And because of where my lobules are, I've got a lot of creasing in my legs. So that would add to that sweating, and it was just a disaster. So I'm always trying to keep things cool. But then also, when I'm working or if I'm sitting for a long time frame, I'll make sure to like move my feet, like circulate the blood flow. And that helps to, it doesn't relieve the swelling, obviously, but it at least helps to keep things circulating and not pooling as much as they would if I wasn't doing any movement.
Mm-hmm.
And then trying to get up and walk around because I had a desk job. So, trying to get up to walk to greet a customer or get some papers or, go to the back office, so just keeping up moving as much as you can and keeping that walking going. Is really the only things that have helped. Like I said, the manual lymphatic drainage did work, but I wasn't able to keep that up. And then the skincare, like the lotion and stuff, that really does help, because I find that the drier my skin is, the more prone I am to it cracking, and then it becomes an open wound, then it opens it up to cellulitis. So trying to keep it moisturized as much as possible. And in the sweaty areas, like the folds and stuff, I'll put like a cornstarch baby powder, so that it can minimize friction and minimize that sweating in those areas, making sure that I'm drying off as best as possible after a shower. So just keeping all of those things in mind have kind of helped me to manage over the last 10 years.
Awesome. Those are great suggestions. I feel like that's exactly what I say to my clients all the time that have desk jobs.
Yeah.
Get up and walk around, find something to stand and do. Yeah.
So I guess the last question that we have here is, what are the challenges you face in ongoing management of your lymphedema?
2.5 2 year wait to get
Oh.
into to get into be reassessed. Yeah, that
Oh
was
man.
a long time.
Yeah, Karen, unfortunately, we lost track of her. I think about was COVID, and it's like you need a new referral. I don't know you anymore. You go back on a wait list. So Karen persisted. So thank you. It's not a perfect system for sure.
No, but I think that's probably one of the biggest challenges. That's for sure.
Staying in touch with your therapist, making sure you keep in touch with the therapist to get the renewals done for your legs. Because yeah, biggest challenges is it the calendar, keeping track of. You're pretty organized, Karen, but
Oh, it's in there now.
it's hard. That's the hardest thing that patients have, I
Yeah.
find, is just keeping track of when they need to come back to see me.
Yeah,
See us as therapists just to get renewed with the authorization. So
that's
they
right.
don't drop the ball and it's like, oh no.
Yeah,
So
and have another 2 year wait.
what about finances and the costs of garments?
Yeah, that can be challenging too now that I'm retired. Um, so we have savings set aside, so I use that as well. But yeah, they're kind of costly,
Are you
but it's
familiar?
important.
Yeah, exactly. I know you have to prioritize them. Are you familiar with the disability tax credit?
Not
That
entirely. I know my brother has talked with me about it, and so I need to look a little bit further into that.
Yeah, I do say that to some of my patients, especially if they're more involved and if you have up to 14 hours of involvement, like if it comes time to doing your skincare, cleaning your skin folds, putting your garments on, taking them off, washing your garments, looking after your self MLD and all of that stuff. If it's over 14 hours a week, you could qualify for a disability tax credit. And
Oh,
you can bring the forms in if you see an OT or your family physician, we can fill them out for you. I think some physios can fill it out, certainly with regard to some of the issues too. So just talk to your clinician, the clinician that's involved in your care about that. So,
okay. Thank you.
and Carissa, the challenge as well that the ongoing management of lymphedema, you've mentioned it a little bit. What's involved with the reduction kits?
Yeah, so like I haven't officially started my treatments yet, but I think the biggest hurdle that I've come across is just the doctors and the lack of knowledge. And this isn't therapist wise, this is like actual doctors that have to diagnose. Or even if you go into the hospital, like if you have to go into the emergency room, they see a lobule and they're like, what is that? Like it's just the lack of knowledge. The fact that I have to educate a doctor on the condition that I have is really frustrating. Or they'll look at me and they'll just assume that I'm fat and overweight and lazy and I don't do anything. I actually had a nurse ask me in the hospital during one of my cellulitis days, when I got out of the hospital, how did I want to contribute to society? And I was like, are you kidding me? I was appalled that she asked me that, but it was because of my size. And she just assumed that I didn't do anything. And I'm like, I've been a branch manager for however many years it was at that time. And I put in 50 to 60 hours a week, you know? So I think it's just the lack of knowledge and the assumptions that people make when they see something that they're not familiar with.
Weight bias and stigma.
Yeah.
Yeah. Well, on that note, having mentioned something about the lack of diagnosis, that's one of the pillars that the Alberta Lymphedema Association is going to be working on. And so hopefully, one of the things that we can hopefully try and do is get some of the clinicians more knowledgeable about it. I know that was my motivation to going into lymphedema treatment is I went 25 years as a clinician, not knowing anything about what lymphedema was. Not even knowing, not knowing nothing about it, which is shocking considering, well, that's just a lot of years going by without knowing anything about it. So it maybe shows that it's a little bit rare as well, but the fact that nobody mentioned, it was always mentioned in the periphery of everything we dealt with. So it was never mentioned as something we could actually affect change in.
And yet it's not as rare as we think. When you look at the statistics in the States, and I don't know what the Canadian numbers are, but I was just reading an article in the States, there are more people affected by lymphedema than multiple sclerosis, muscular dystrophy, ALS, HIV, and Parkinson's all combined. So those 5 diseases, and there's more people affected with lymphedema than those 5 diseases combined.
Wow.
But yet there's still such a lack of knowledge.
Yeah.
You know, so it seems rare, but I think it seems rare because people just don't talk about it enough or they're undiagnosed, right?
Yeah. And then the phlebo lymphedema, we haven't even talked about the cancer. We haven't talked about anybody with cancer related lymphedema, but they're actually the smallest portion, or not as large a portion of lymphedema in the grand scheme of things. When you add in all of the patients with chronic venous insufficiency related lymphedema or obesity related lymphedema, primary lymphedema is also in there, but it's a smaller sort of piece of it, but a lot of it is the phlebo lymphedema that causes a lot of, would you agree with me, Heather, on that stat?
Definitely. Well, that's what the CLF did, that prevalence study, and they actually, it's way at the top, but they actually, it's so many that they feel like they can't even predict the amount accurately, but it's definitely the most. And then obesity is second, and then I think cancer is underneath. So we definitely have to, but I have, this year I actually was on the ball and I tried to celebrate March 6th lymphedema, World Lymphedema Day, and I got my manager to send out, well, at least I really hope it works, the physician card that I can't remember, was it the CLF that made the physician card? And we're hoping to send that to kind of distribute it to at least all of Allied Health. I said send it to everybody, all physicians, everybody. I don't know how widespread they'll get it, but
isn't that one of the resources that we have on the lymphedema website? It's one of our resources.
Yeah, it's the physician card, and it's just really simple, 2-sided. Here's what you need to know, and just to kind of bring awareness. And on that note, I do have to step out. Got a hockey game to get to. Thank you very much for having me. And Carissa, I hope to talk to you this week to set up an appointment.
Yes.
All right. Okay. Take care, everybody. Thank you.
Thanks, Heather.
Bye.